How's your heart doing? Your mouth might know before you do. 4 oral warning signs you shouldn't ignore. Hello, dear friend. Let me tell you something most folks don't realize. Your mouth can give away clues about your heart health, long before your heart shouts for help. Yes, really. It's like a quiet whisper before the storm. You ever catch a glimpse of yourself in the mirror one morning and notice your lips looking a bit purplish? Or maybe your gums look pale, your tongue unusually red, or even a bit swollen underneath. Now, most of us would just think, must be poor sleep, or maybe it's something I ate. But here's the thing, sometimes it's not that simple. Sometimes it's your heart quietly sending out an SOS. Why the mouth reflects heart health. Think of your heart as your home's central water pump. It beats over 100,000 times a day, pushing oxygen-rich blood throughout your body. And the first place to show trouble? Often it's your mouth, especially the lips, tongue, and gums. That's because these areas are packed with tiny blood vessels. If something's off with your circulation or oxygen levels, your mouth might be the first to show it. In fact, ancient Chinese medicine said it thousands of years ago, the heart is connected to the tongue. Modern studies are beginning to agree. Let's walk through 4 key signs your mouth might be warning you about your heart. 1. Bright red tongue tip, like a ripe strawberry. A healthy tongue is usually a light pink, same color across. But if the tip of your tongue turns bright red and shiny, almost like a ripe strawberry, pay attention. In Eastern medicine, this is often linked to something called heart heat, caused by chronic stress, poor sleep, or spicy/fatty foods. But Western medicine sees it too. It could relate to arrhythmias, irregular heartbeat, or even early inflammation of the heart muscle, myocarditis. The red tip? That's due to tiny blood vessels expanding under pressure. Research shows 60% of people with arrhythmias notice this change before other symptoms. You may also feel a dry mouth, bitterness on the tongue, trouble sleeping, or have strange dreams. All of these, combined, suggest your heart may be overworked. 2. Bulging veins under the tongue, like tiny blue worms. Here's an easy check. Stand in front of a mirror, lift your tongue. See those 2 blue veins underneath? In healthy folks, they should be thin and light, no thicker than 2.7 millimeters. But if yours are bulging, dark blue, or purple, twisting like little worms, and measure over 3 millimeters, it may point to poor circulation and weakened heart pumping. This shows up in conditions like heart failure, chronic lung heart disease, and even coronary artery disease. Studies show up to 85% of chronic heart-lung patients have this sign. The more prominent those veins, the more pressure your heart is under. 3. Bluish or purplish lips, a sign of low oxygen. Healthy lips? They're usually a nice rosy pink. That color comes from oxygen-rich blood. But when lips turn blue, gray, or purplish, your body might not be getting enough oxygen. This typically happens when blood oxygen levels drop below 85%. Your lips are like an early warning system. Common causes? Right-sided heart failure, when blood isn't pumped to the lungs properly to get fresh oxygen. Pulmonary hypertension, high pressure in the lung arteries strains the heart. Congenital heart defects, rare but serious. Now, if your lips are turning purple while you're indoors in a warm room, and you're also short of breath, dizzy, or chest feels tight, you need help. This could be the start of a heart attack or pulmonary embolism. Don't wait. Call emergency services immediately. 4. Pale gums like a faded rose. Normally, your gums should look light pink with a bit of shine and bounce to them. But if your gums are pale, grayish, or white, it could mean your heart isn't pumping well enough. Weak heart function slows circulation, which affects how your digestive system absorbs nutrients. This can lead to iron deficiency anemia, and the gums are one of the first places to show it. Research shows over half of people with chronic heart failure also have some form of anemia. And the worse the heart function, the paler the gums. If your gums are pale, it's not just a dental issue. It could be your heart crying out for help. What if a heart attack hits suddenly? Let's be clear. The most dangerous part of heart disease isn't the disease itself. It's missing the early warning signs and losing precious time. Contrary to popular belief, Heart attacks often give warning signs hours or even days in advance. Here are 5 signs to never ignore. 1. Pressure in the chest, like a heavy stone sitting on your chest, lasting more than 15 minutes. 2. Pain that travels from the chest to the left shoulder, arm, jaw, or even teeth. 3. Sense of doom, cold sweats, nausea, extreme fatigue, like your body knows something's wrong. 4. Jaw or stomach pain mistaken for something else. Older adults often mistake heart pain for dental or indigestion issues. 5. Chest pain at rest. If it hurts even when you're sitting still, that's serious. If you suspect a heart attack, do this immediately. Time is muscle, as cardiologists say. Every minute counts. Here's a 3-step emergency plan. 1. Stop immediately. Sit or lie back. Don't walk, drive, or try to push through the pain. 2. Take nitroglycerin under the tongue. If your doctor has prescribed it and your blood pressure is normal. 1 0.5 milligrams dose. Repeat every 5 minutes, up to 3 times max. 3. Call 911 or emergency services. Tell them it's chest pain. If possible, head to a hospital with a chest pain center. They're faster at clearing blocked arteries. Remember, every minute you wait, 190,000 heart cells die. The first 2 hours are your golden window. How to take care of your heart, starting today. You don't need fancy supplements or strict diets. Just remember these 3 keys. 1. Eat heart smart, the simple more and less rule. More: wild salmon, oats, brown rice, spinach, kale. Less: fried foods, margarine, salty snacks, sodas, processed sweets. Try a Mediterranean diet: olive oil, a few almonds, a glass of red wine now and then if your doctor says it's okay. Studies show it can lower heart disease risk by 25%. 2. Move just enough, 150 minutes weekly. Walking, dancing, tai chi, or swimming are perfect. Avoid intense workouts early in the morning when blood pressure spikes. Try afternoon or evening. Keep your heart rate at 220 your age, x 60 to 70% for safety. 3. Stay warm, stay calm, stay kind to yourself. Cold weather, heavy meals, and stress can trigger problems. So bundle up, eat light at night, and give yourself grace. You've earned it. Take care of your heart like it's your best friend, because really, it is. It's been with you through thick and thin, and it deserves your attention now more than ever. With warmth and wisdom, your old friend in the States. Subscribe now and join our growing circle of wise elders who are embracing life on their own terms. Let's walk this meaningful path, not alone, but together. You deserve inspiration that speaks your language. Let this be your cozy corner on the internet.